cohort of patients that they have who are now late teenagers. And when they first wrote these articles, these teenagers were about 13 to 16 years of age. And he started out with 926 children born preterm, and they were randomized at birth to receive preterm nutrient-enhanced formula, donor breast milk, or standard formula. Okay? 216 of these infants were reviewed at the age of 13 to 16 years. And one of the outcomes that they looked at was something called flow-mediated endothelium-dependent dilatation. The way this works is you take a blood pressure cuff and you put the blood pressure cuff around the arm of the individual for about 5 minutes, inflate it, and then you do an ultrasound of the blood vessels, the arteries, as they dilate. Okay? A healthy blood vessel should dilate very rapidly. An unhealthy blood vessel does not dilate very rapidly. So what did they find? They looked at the individuals who had the low weight gain. These are premature babies with the low weight gain versus the high weight gain. And the ones with the low weight gain, this is in the first 2 weeks of life in sick premature babies, the ones with the low weight gain had higher flow-mediated dilatation. Okay, so this is telling us that those babies who were the ones who were not gaining much weight in these first 2 weeks were the ones who actually ended up doing better. Okay, these are the high weight gain group. The difference between these two is similar to the difference between smokers and non-smokers. However, one of the things you look at here that raises some doubt about this data is that the high weight gain babies were the same as the term controls. Okay, so some questions have been raised about this data set. Then they looked at another outcome, and they published this in a different journal. They looked at 32-33 split proinsulin. The higher the 32-33 split proinsulin, the more the likelihood of development of type 2 diabetes. Okay, the ones who gained the least weight, over here, gained the least weight, had the lowest levels of 32-33 split proinsulin. Those who gained the greatest weight had the highest levels. Okay, so what is this telling us? Is this telling us that not gaining any weight in the first couple of weeks of life is actually a good thing? Well, let's talk about this a little bit more. Should we restrict the diets in these babies in the first couple of weeks to prevent later metabolic syndrome? Well, we do know that if you restrict a diet of a very sick baby, that baby is going to become catabolic. Okay, what that means is that baby is going to break down his or her own tissue, and that could have actually lifelong consequences, especially when it comes to the brain. Some studies done by Betty Bohr and others have looked at what happens when you have catch-up growth. If you have adequate catch-up growth in both AGA and SGA babies, you have good neurodevelopment. If you have delayed catch-up growth, if you don't have catch-up growth, then you have decreased mental and motor function in both AGA and SGA babies. So, we're left with maybe a dilemma. If you believe the studies of Lucas and colleagues, we're left with a little bit of a dilemma here. If we do not have catch-up growth, then we have a lower likelihood for the development of diabetes. But the babies will have a different kind of a neurodevelopment. Okay, lower diabetes, higher IQ. Or we can have diabetes, obesity, and lower IQ. Something's a little bit wrong with this picture. Now, when you look at the studies of Lucas and colleagues, I think you have to be very careful, because a lot of people have overinterpreted this and have actually gone to the point of restricting food in the babies in the first couple of weeks of life, or continuing to restrict. Remember that very small babies do not even regain birth weight in the first 2 weeks. Much of the weight change that we see in these first 2 weeks are due to fluid shifts. And again, the food restriction leads to catabolism, which can increase morbidity. And there's probably some other explanations for the metabolic morbidity in these babies. And I just want to discuss this a little bit further here. Now, some of us are normal, some of us look like apples, and some of us look like pears. Okay? Now, which one of these, the apple or the pear, is the least healthy? Okay? If you had your choice to be an apple or a pear, okay, the apple is the least healthy. Okay? Okay. Now, the reason the apple is the least healthy is because of this. Okay? You have intra-abdominal fat. Okay? Not so much the fat that you can squeeze on the outside, but the fat that's on the inside. Okay? This is a MRI of somebody who has a person that has type 2 diabetes, and this white here represents intra-abdominal fat. Now, what about babies? At the Imperial College in London, Dr. Uthaya and colleagues have looked at this using MRI, and they have some very interesting work that shows the relationship of prematurity versus being born term, and also stress on the intra-abdominal fat. Okay, so what they did in this study, they had 38 preterm infants and 29 term infants. And these preterm infants were all around 28, 30 weeks gestation, and they let them grow to be the same equivalent age as the term babies. And then they did the MRIs on the babies and did fat measurements. They're able to look at adipose tissue mass, total adipose tissue mass here. And as far as total adipose tissue mass, the preterms were the same as the term babies. Now, when they looked at subcutaneous, stuff that you can squeeze, okay, on the outside, the term babies over here had the higher subcutaneous adipose tissue volume compared to the preterms. This is the intra-abdominal internal adipose tissue volume. And here the preterms had a higher intra-abdominal tissue volume. Okay, so the preterms are showing more abdominal fat compared to the terms. Now this is a little bit tricky to understand, but I'm going to try to run you through this. When they looked at the subcutaneous adipose tissue volume and the level of intensive care, okay, level 1 and level 2 intensive care in England is the most high level intensive care. Okay, those are the sickest babies. So what they did was look at the percentage of subcutaneous fat and then did a correlation, a statistical analysis between the level of intensive care, and here you see a negative before this correlation coefficient. What this means is that the more sick these babies were, the less subcutaneous fat they had. But what about the intra-abdominal fat? You look over here and you don't see a negative sign. So what they had here was a positive correlation. So the sicker the babies were, the more intra-abdominal fat they had. The sicker they were, the less subcutaneous fat they had. Okay? Now, why would this be? Let me just summarize this real quickly. The preterm infants had a significant decrease in subcutaneous adipose tissue and increased intra-abdominal adipose tissue, and illness severity was the principal determinant of the increase in the intra-abdominal tissue. And they thought this might be due to glucocorticoids, and the hypothesis they raised was looked like this. You have premature baby, was sick. The sicker the infant is, with more intensive care, the more highly stressed those babies are. And with that higher stress, they have a greater cortisol secretion. And these babies normally, at 28 weeks gestation, have growth hormone hypersecretion and low IGF. And this leads to insulin resistance. That stress and cortisol increases the insulin resistance even more. So you have secondary hyperinsulinemia, increased intra-abdominal fat, altered leptin, adiponectin, and pro-inflammatory mediators, and an increased risk for metabolic syndrome. Okay, still that remains a hypothesis, but I know that the people at Imperial College are looking at this a little bit more in more detail now. What about breastfeeding and obesity? Well, generally, it's thought that breastfeeding might protect against obesity. There's a recent review that looked at 14 studies published between 2003 and 2006. And they looked at breastfeeding and risk of childhood overweight and obesity. 8 of these studies reported a protective effect in children or adults, but there were some studies, 6 of them, that reported no protective effect. So still the balance of the studies do suggest that breastfeeding might be protective against obesity. This is a quote from Dr. Ziegler. There are no consistent differences in adiposity during the first 4 to 5 months of life. But during the later part of the first year of life, the preponderance of the evidence suggests that breastfed infants are leaner than formula-fed infants. And formula-fed infants at 4 to 5 months show higher plasma levels of insulin like growth factor 1, IGF-1, insulin, and certain amino acids than breastfed infants. Now, in Europe, there's something very interesting going on. Dr. Koletsko and colleagues have started a very large study with the hypothesis that higher protein intakes in babies is what is actually associated with obesity. I know that we've been talking about high protein being good. That's especially the case in the preterm baby, but what about the normal term infant? Well, they have this hypothesis that higher protein intake actually results in obesity. And the results of that study are still not in, but at least to my knowledge, but they should be publishing that somewhere in the next couple of years. Let me go further here. Now, as far as really being able to study the mechanisms of things like the Barker hypothesis and early feeding and subsequent outcomes, obesity and type 2 diabetes, these are next to impossible to do in humans. Okay? If you want to do these kind of studies, it would probably take 50, 60 years with several generations to be able to do this. So unfortunately, what we are left with is animal studies, and we can also harvest tissue from animals, certainly something that we can't do in humans. There are several different animal models, and I'm just going to briefly touch on this litter manipulation model, and then I'll talk more about the rat gastrostomy feeding model. The litter manipulation model is one that actually was a model that was used by Drs. McCants and Widdowson and others in the early 1960s in England. And we actually got some of our original information that suggests that early nutrition can program the individual later on. Okay? The way this works, the way this litter manipulation works is you can take